Now, just before I hand to Brett to speak to what's changed and what we have to face, the very challenging reality that we all have to face over these coming weeks, I just want to make it very clear, there are more than 70,000 AstraZeneca appointments that are available in state clinics right now. There is, I think, a sense, and it's not a criticism, it's just a sense that I think has grown, that people can wait. People can afford to wait, that they'll get a vaccine of some sort or another down the track. They can get it in a month or two, and that'll be all fine. My message to every Victorian is no, we cannot wait. You need to get vaccinated, and you need to get vaccinated as soon as possible. And the best vaccine is the one that you can access today. I don't have Pfizer for everybody, and it is a long time off before we will have Pfizer for everybody who perhaps wants that. Again, I'll just make the point, 2.6 million doses of AstraZeneca have been administered in our state over the last few months. This is a choice that literally millions of Victorians are making. It is a safe vaccine. It is an effective vaccine. It is the vaccine that is available now, and that means for the vast majority of people, it is the best vaccine right now. Of course, there is an informed consent process. Speak to your GP. Or if you make a booking at a state clinic and you come to one of our state clinics, we have guaranteed that there will be a senior clinician, either a doctor, a pharmacist or a senior nurse immuniser, who will be able to talk to you about what AstraZeneca means for you, and then you can make an informed decision, as literally millions of other Victorians have made. Those appointments are available right now. We can't wait for stocks to arrive when promised in September, October, November. We can't wait for deals, albeit they're good deals to do, but we can't bank on the next deal that's done with Poland or Singapore. There is good, effective, safe vaccine available right now. We've always pushed this because it's always been true. It is a safe and effective product, and it is on the shelves available in the warehouse right now. The appointments are there. If you go online, you can put your name beside one of those appointments and play your part. More than 70,000 available right now over the next 3 weeks. If they're taken up, we'll add more. We will add more. And we will be closer, sooner, to that 70% first dose target and all the other vaccination targets that are critical to us protecting our health system. These are not easy decisions to make. This is not the advice I wanted to receive. I'm sure it's not the advice that the Chief Health Officer wanted to give us. But none of us have a luxury of pretending that reality isn't just that. The difficult circumstances that are all too real that we face across our state. If we all look out for each other, if we all do as we've done before and find it in ourselves with support to get through this, then we can vaccinate faster than cases grow. If we opened up, that would not be the case. In fact, cases would grow so much faster than we can vaccinate people. And that means our hospitals will be full, and that means COVID patients and all patients, regardless of what you need, will have their care compromised. As I said yesterday, we can, all of us, manage a pandemic of the unvaccinated if that number is quite small. That group of unvaccinated is quite small. But at just 35% double dose, in Victoria and across the nation, they are the numbers. The group of people who are yet to be vaccinated is just too big for our nurses and our doctors and our ambos to cope with. We've got to buy time to allow vaccinations to be undertaken, all the while doing this very hard work, this very painful and difficult work, to keep a lid as much as we can on cases. What's changed is in these last 2 days, the public health team have changed their advice to us, and I commend them for the work they've done. We've thrown everything at this. But it is now clear to us that we are not going to drive these numbers down. They are instead going to increase. Now it's up to us to make sure that they don't increase too fast and that they don't increase too much relative to the number of people who are getting vaccinated every single day, every single week. I'd much prefer to be here announcing that we're opening up. There'll be a time for that. But it simply can't be before we get to 70% double dose and 80% double dose. There are some things we can do along the way. I've announced some of them today. We will look very carefully at whether there is more that we can do. And if we can do that safely, then that'll add to the list for the 22nd or 23rd of September. Until then, please get tested as soon as you have symptoms. Please follow these rules. They're about your safety as much as anyone else's. They're about making sure that our nurses and doctors don't have more work to do. And please go online and book a vaccination appointment. Talk to your pharmacist, talk to your GP. There's vaccines there available. Let's use up all those appointments. This is a race to 80. We can't do this on our own. We need the community broadly to do all of those things and more. I know I'm asking a lot, but we can achieve this and we will. We've always been well served by following advice, and now is no different. I'll now ask the Chief Health Officer to speak to that advice and to provide some background, and then Jerome will speak to the outbreak map, if you like, and then we're happy to take any and all questions that you have. And I would say that whenever we've made rule changes, we don't make things up from the podium. If there's anything we have to come back to you on, we will. There's very few changes happening right now. The majority of these, as modest as they are not occurring for 3 weeks, but we'll endeavour to give you as much clarity as we possibly can. Chief Health Officer.